Good morning, everyone. My name is Beth Hutton, and I work at the Texas Institute for Excellence in Mental Health at the University of Texas. And I work on a project named the Alliance for Adolescent Recovery and Treatment in Texas. And this project is a SAMHSA-funded project. HHSC receives those funds, that is the Health and Human Services Commission. Sorry, I will try not to acronym everything. The Texas Health and Human Services Commission receives those funds from SAMHSA, and then they contract with us at Texas Institute for Excellence in Mental Health, which I will say TIMH from now on, so that's so long, to administer this grant. And we call the Alliance for Adolescent Recovery and Treatment in Texas, ART Texas, so you'll hear me saying that instead of the long words as well. So what this grant and this project essentially is geared to do is to bring evidence-based assessments and treatments to the communities across Texas for adolescents with substance use disorders or co-occurring substance use and mental health disorders. So the project is aimed at doing that, but it is also aimed at bringing a strong recovery support services to those youth as well. And I'll be talking more about how that process works as we go along throughout the day, but I wanted to give you a little bit of background about what this project is and how it came to be. So we've called this a work of art today, kind of playing off of our name a little bit. So what we've done the last 2 years with this project, we did a planning phase, so 2 years of planning prior to what we are now starting our implementation phase. And during that planning phase, we did a lot of looking across the state of Texas at what services are out there, what strengths are there, what gaps, what needs do we have, and we found a lot of needs. While there are also a lot of really, really great projects and programs going on out there, there's a lot of people out there doing some really super work in this area. There are a lot of needs. And so some of the big things that we noticed, and remembering that our project is for 12 to 18 years old across the state, thank you, Sierra, looking at 12 to 18 years old across the state with substance use or co-occurring disorders, the Health and Human Services Commission estimates that nearly 182,000 youth in the state meet criteria for a substance use disorder. And over half of those youth in need of treatment come from families with incomes 200% below the poverty line. Half of them, that's over 100,000 youth. So when we looked at that, only 5% of those eligible youth below the 200% poverty level received services in 2015. 5%, that's 4,760 youth received services out of 103,000 plus that needed it. So that's a pretty staggering number right there. So 95% of the medically indigent youth were untreated. And when we look at the statewide behavioral health strategic plan of Texas that covers 2017 to 2021, this is also identified as something that needs to be addressed in our state. So it's not just our project, but also the statewide behavioral health strategic plan has also identified this as a need. So that's a lot of youth who need services who aren't receiving them. So when we did our 2 years of research prior to now, we looked at a lot of things. Why is this? Why are these youth not getting the services they need? One of the things is the workforce. While there are a lot of people out there very passionate about this field, there's just not that many people out there trained in adolescent substance use disorders or co-occurring disorders. So what we found is that the majority of the workforce are non-Hispanic, white, middle-aged, female, which doesn't really meet the criteria and the demographics of the population in need. So that's one thing. Many of the workforce are also age 56 and above, indicating that many of them will likely retire within the next 10 years. So and also when we look at services for youth, it's very beneficial if we consider people who are close in age who can relate more closely with them. So the workforce has some needs to become more closer to the age of the youth, more demographically like the youth. Some of the other things we looked at were location. the workforce that is out there are in the 5 most populous counties in the state, meaning that and as you all know, Texas is a huge state. So if you look at the 5 most populous counties, that means there are just areas with very minimal workforce out there that are specifically trained in substance use, and then even fewer who are in looking at adolescents, and even less with co-occurring. So there's a big gap there in the services for adolescents of this age. And then licensure is another thing we've looked at. And when you look at licensed chemical dependency counselors in the state, we do have a great number of licensed LCDC interns, but many of them don't ever advance to full licensure. And some of the things we're thinking could be because there's a great number of hours required of supervision. There's many things we're looking at there to see why they are not progressing to full licensure. So those are some of the workforce issues. And then the next one is evidence-based training and adolescent SUD and COD training. So many of the universities, colleges across the state, and nationwide really, might have, for LCDCs or for counselors or social workers, might have some training that hits a little bit on adolescence or substance use, but it's typically not a specific program. It's not something that it provides a specialty in that area. So while there's little pods of training, there's not really a great specialization to create this workforce. So those are some things we're looking at as well. And then also continuing education afterwards. So, and then another thing I have there is cost. So for those people that are already out there who are licensed, getting training in an evidence-based practice is quite costly. So we're looking at how can we bring these services to practitioners in an affordable way. And then also looking at recovery support services across our state, because like I said, we need to have a good recovery system for youth. After they've completed treatment, they need to be able to sustain their recovery. And one of the things that we're looking at, and there still needs to be much more research done, but what we're looking at is youth who are engaged in the recovery process from the beginning, because we know that relapse or reoccurrence is a potential for many people who are going through treatment. If we can provide them those recovery support services from the beginning, they are much more likely to sustain a long-term recovery. Because if we can anticipate and predict and provide supports when they need them, when reoccurrence or relapse might happen, then we can provide them what they need and help get them back on the track of their recovery. And some of those recovery support services, like I said, there's many great things going on out there in our state right now. There's just not enough. Texas is a huge state. We have 8 youth recovery communities, which are funded by the Health and Human Services Commission. Those are really fantastic programs out there, but again, 8 in our state is not enough. So we need to boost that up. Continuum of care, like I talked about earlier, we need to make sure that from screening to assessment to treatment to recovery, all of those things need to be fluid. And whatever the youth need throughout that continuum needs to be met. So that could be the development of adolescent ROSCs, which is a recovery-oriented system of care, which brings all of these recovery pieces together. Alternative peer groups, places where youth can go to have sober interactions with other youth who support them in their recovery. Collegiate recovery programs for those who are in the university setting so that they can maintain their sobriety while they're getting their education. Recovery high schools, the same thing, only for high school age students. And then sober fraternities are a new thing that are starting to build, and there's one here near the campus on UT. So those are all some of the recovery supports that really need building up. Youth and family voice, I have that on there because SAMHSA really promotes that, and in everything that we're finding out there when we've done our research is that youth need to be able to promote what they need in the system. We can't design a system about and for youth without their voice and understanding what it is they need. We can't guess what they need. We need to understand, we need to talk to them, and they need to be a part of the process from the ground up, all the way up to policy and implementation. And also their family members. Parents have parents and family members have a lot to say too, and we need to make sure that we're looking at what their needs are and that we're meeting their needs as well. And then a couple of the other things I have on here are stigma and social norms. You know, some of the things that we're fighting are societal beliefs and thoughts. And if we don't look at why are we not changing the culture, shifting the way we think, helping parents understand that just because it's the way things happened back when we were young, or that, you know, just because this is expected behavior for a certain population, maybe we need to help youth understand that there are safer and more appropriate ways for them to go out and have fun, and help encourage them to do that. So some of these things are big things that we need to look at and see if we can provide some culture shift. And that's going to take outreach and, oh, what did I do? Little glitch, sorry, that was me. So what now? These are some things where, all of the things we talked about, the need, these are some things that we're looking at in my project. But my project isn't the only one. There's so many things going on, and all of the things I talked about before. What I see is all of these things coming together and working for the greater good, right? This isn't something that one project can do, but this is something that our project strives to work toward. And all of the things we talked about before, these are some of the things we're looking at trying to incorporate to make the system better. Developing a system that's driven by youth and family voice, increasing affordable evidence-based practice and other best practice training opportunities for clinicians, developing curriculum to create specializations in adolescent substance use and co-occurring. And then those outreach efforts to help the community and clinics that serve youth and education systems and the youth themselves and parents, helping them understand about adolescent substance use disorders, what it is, what it isn't, and how we can change the way that the society thinks. And then also, communities need to know. If we can help them build their capacity to know what substance use disorder is, how to screen for it, they have to know where to refer as well. So helping these communities develop a system to refer from screening to treatment to recovery supports and keeping that continuum going. We need a bigger workforce, and not just LCDC social workers and counselors, but we also need youth peer recovery coaches. So those people who are closer in age to the youth, who can really be there for the youth when they need them in these moments. And then increasing recovery support services, like I talked before, adolescent recovery-oriented systems of care, alternative peer groups, recovery high schools, communities for students in recovery, and sober fraternities, and then capitalizing on all of this above to create that community for youth that just wraps around them. So when they need assessment, when they need screening, when they need treatment, when they need recovery, all of those pieces are there for them, no matter where they are in the process. So if they are in a relapse, then we can help them bring them back in. If they are in treatment, then they know that recovery is coming. So all of those things are there. So that's kind of where we're headed with our project. And all of these takeaways basically wrap up what I said earlier. So these support all of the things we're talking about there. And what I'm going to do now is just kind of open it up for any questions. I know one of the things we're supposed to do in each of these coffee talks is to come away with a, I don't know if it's a call to action, but it's a recommendation for the summit at the end. What do we recommend from this talk? What can we recommend for the summit as we move forward? And here at the end, I have my contact information. My colleague, Tracy Levins, was supposed to be here with us today, and she had some things come up. She wasn't able to come, but I have her contact information there as well. So I thank you all for listening to me go on and on. I welcome any comment or conversations as we move forward. Thank you.